Hello, everyone, and thank you very much for joining us today. My name's Deborah Garlick from Henpicked Menopause in the Workplace, Menstruation Friendly, and Director of Menopause Friendly Australia. And today's Lunch and Learn is all about keeping your vagina happy through menopause and maybe much broader than that. You'll hear more very shortly. And my colleague Jo Lee is going to be helping with any questions. So please do let us know what's on your mind about menopause. About vaginal dryness. So I'm delighted to introduce my special guest today, Dr. Imogen Shaw from Hormone Health. And are you there, Imogen?
I am. Can you
Good.
see me right?
I can't see you at the moment, so please, I'll try and get your camera on very shortly. But there you go. I think I can see you now. So thank you very much for joining us today. And today's session is an interesting one because, of course, before you joined or before everybody joined us today, we started saying, how comfortable do you feel talking about vaginal dryness? Using those words. We're on a bit of a journey with this one, aren't we? Very similar to 10 years ago, it used to be difficult to use the word menopause in public. And here we are, seem to feel like just a normal word to us. But vaginal dryness is very different, isn't it? That one is still very much a taboo.
Yes, and that's why I chose to talk about it, because I think it is an area of women's health that isn't really talked about still. And I think partly it's women's feel a bit embarrassed to come forward and volunteer information about it. I'm sure they feel they don't want to bother their busy GP with something that they might find trivial. Um, And I think also us as healthcare professionals are not good at asking about it. We're not good at putting forward open questions that open up the conversation with women. So
We
we,
do. Absolutely. And so, vaginal dryness, keeping your vagina happy. And we're not talking about, my thoughts immediately went to Tom Hardy or my husband, of course, or David Beckham or whoever it is that for you, this is something that more women experience than many people realize. You opened my eyes when we were talking about vaginal dryness, for example, and you were saying it's not just those of us through menopause.
yeah, it does in fact affect to some extent all ages. You very rarely see girls before they start their periods and they complain about, pain down below. And they've got a little bit of adhesions where their labia are stuck together because they're low estrogen. That's very rare. Don't often see that. But I do see women who are on progesterone type of contraception. So the mini pill or the little Nexplanon rods in your arm or the depot injections, they are all progesterone dominant. And these women can experience some vaginal dryness. Again, really easily treated either with some vaginal cream or just moving on to a more estrogenic kind of contraception. And the other group I see is breastfeeding women. Just had their baby, just wanted to get their sexual relationships back, and they find that intercourse isn't very comfortable. And that's often because when they're breastfeeding, their estrogen levels are a bit low and they experience vaginal dryness.
That was a
Again, yeah, really
complete
easy to
revelation.
treat.
Absolute revelation to me. I never thought about that. So we put the session on around keeping your vagina happy through menopause, but this isn't any stage of life, or it can be affecting lots of different people, not just those of us experiencing the menopause transition or beyond.
Yes, absolutely.
So, a big question, why does vaginal health matter?
Well, I think it contributes significantly to women's overall health and how they feel about themselves and their relationships. But also, when women have worse symptoms, it affects their daily life. It affects their activities. They can get discomfort on walking or riding a bicycle. They can experience, yeah, discomfort with sex, burning, itching, irritation, which intrudes into all aspects of their lives.
And that is something I know. Joe talks about vaginal dryness. Our team talk about vaginal dryness as one of the symptoms of menopause whenever we do training. And actually, I might ask Joe to share some of her experiences of when she's talked about it in the workplace. But you might say, well, it doesn't affect you in the workplace, but you don't leave the symptoms at the door. It can affect you at work too.
Yes, absolutely.
Absolutely. Joe, you get the conversation going in workplaces, don't you?
Absolutely, yeah. And for some people, they feel slightly hesitant about talking about it because they feel it can be quite embarrassing. But once you do start to talk about it in a workplace environment, so many people have so many questions about what they can do, and they become so much more open about it. And yeah, I think the key questions are around discomfort and relief and how they can manage that without feeling embarrassed about it.
Absolutely. So this really matters. It should be something that is talked about, whether it's with your GP or we shouldn't feel embarrassed talking about it. Thank you, Joe. But what are the sort of symptoms? How would you know that your vaginal health wasn't what you'd hoped for?
Mhm. Well, I think women notice, or just look, starting at the basics, looking at the outside, the outside labia, women can notice changes in their shape of their labia, bit of loss of pubic hair. So externally, they can notice a difference. Internally, most women don't look inside themselves. So vaginal dryness, usually the first thing they notice is pain with intercourse, um, lack of lubrication, a difficulty inserting tampons, and then there's just this irritation and itching that some women experience, or a real sense of burning that some women get.
And so what that I mean I didn't know that one about changes to the environment. You know, you say loss of pubic hair. I would never have thought of that. What actually causes this?
Well, it's a loss of estrogen and a loss of blood supply to the area. Then you get a lack of collagen, which makes up part of the labia, which is why they thin. But also, estrogen has the whole vaginal lining and urinary tract is lined with estrogen receptors, and none of that area likes being low estrogen. And as well as all the symptoms we've already talked about, women also experience urinary symptoms, which they often don't attribute to being low estrogen or to the menopause. But women often notice more urinary tract infections after the menopause, more urinary frequency, and that urgency that is
Yeah.
very typical of the menopause. Get home from your shopping, put the key in the door, have to dash to the loo. That's very much a menopausal issue. And some women don't empty their bladders properly, so they're getting up at night to go. And that again encourages the lack of emptying encourages infection.
So this is so much wider. Is that called atrophy? I read about that somewhere. That's called atrophy when the skin thins and it looks different.
Yes. And looking inside, when I do smears on women, you can tell menopausal women because the inside of the vaginal lining looks red and angry and dry and easily sort of grazed, which is why some women can experience a little bit of spotting after intercourse because the vaginal mucosa has been damaged.
Right. Okay. Wow. So you know this is broader, and as you say, links as well to sort of urinary tract infections, urinary issues. So, you know, we said that this was about keeping your vagina happy through menopause or whenever. What's our top tips?
Well, for starters, women can do a lot to help themselves. You don't have to seek help from a health professional. Um, the first thing I usually talk about, well, the outside skin that we were just mentioning, I recommend a good, bland, non-perfumed moisturizer, just like you do with a baby's bottom, just a bit of protection around the outside skin as it becomes a little more delicate. Inside the vagina, the first thing I usually recommend is a vaginal lubricant. Plenty of them in Boots, very easy to buy over the counter. And they just work by providing more lubricant and glide for use with intercourse. Because obviously that is intercourse related, and not everybody wants to start messing about with lubricants when they're having sex. So the next thing I would go on to would be vaginal moisturizers. Again, buy them over the counter, very easily available, plenty of different brands. And they just work they're completely non-hormonal, and they just draw moisture into the vagina. So it increases that vaginal moisture, and again, helps with discomfort on walking, etc. Those need to be used 2 or 3 times a week. They just maintain that moisture layer. And quite a good combination would be, for instance, using a vaginal moisturizer twice a week, together with a bit of additional vaginal lubricant with intercourse, for instance.
Wow, so that's about keeping the moisture levels in, just as you would do with your face and your face cream. It's appreciating that your vagina needs moisturizer too.
Absolutely, yes.
And how much? Well, I'm going to ask you a question about uh, the is it the estrogen pessaries and things as well? Because you mentioned earlier that estrogen declines. Is there a HRT solution for your vagina?
Yes, absolutely. So that was the sort of things you can do to help yourself. But and in fact, you can now buy estrogen over the counter for vaginal use. But the things I've talked about, they cure the symptoms, but they don't cure the pathology. They don't cure what's happening to the cells, which is that they're getting thinner, they're lacking water content, and they're becoming more fragile. They don't reverse that. If you want to actually reverse that, you need to use vaginal estrogens, and they are the best treatment for all the vaginal symptoms and all the urinary symptoms.
So actually putting the estrogen back can actually help reverse some of the symptoms, some of the underlying causes.
Yes, yes, yes. You can see that the cells will be plumped up. They'll produce more mucus, and the urinary symptoms. Estrogen is very clever. It encourages the vagina to produce glycogen. Then the lactobacilli, which are the normal bacteria that we all have in our vaginas, use this glycogen and make it into lactic acid. So when we're younger, our vaginas have a nice low acidic pH, which then is very hostile to any other nasty, harmful bacteria that might cause infection. Once the estrogen levels drop, there's no glycogen produced, so there's nothing for the lactobacilli to feed on, no acid formed, vaginal pH rises to a nice, neutral, warm environment that's very receptive to harmful or disease-producing bacteria, hence increase in vaginal infections and urinary tract infections.
So this helps with the moisture level.
Yes.
And that helps as well with, whether it's sex or whether it's just general comfort. But that also helps with the urinary issues as well, does it?
Yeah, yeah, absolutely.
Because it slows down or stops or reverses
Those
the, the whole environment.
Yeah,
Well,
yeah.
And you can get that over the counter now. Now, I'm going to ask you a question because some people experience menopause and cancer. How safe is estrogen cream? Is it cream or is it a pessary or is it a ring?
You can get, yes, exactly. You can get lots of different forms. You can get estrogen cream, which comes in a tube with an applicator that you can insert, or it comes as a tablet or a pessary, or as a ring. And the ring is like a little elastic band that you insert into the top of the vagina. It just sits there, slowly releasing estrogen for 3 months. Again, all local. All these preparations provide local estrogen to the local environment, the vagina and the bladder neck. Hardly any of it is absorbed. So with women who've had breast cancer, we obviously don't want to raise their estrogen levels if they've got an estrogen receptor positive tumor, but having local vaginal estrogens is for the majority of women safe. We always do it in consultation with their oncologist, and we make sure we understand what other treatments they're on, so we're not interfering with their other cancer treatments. But in general, yes, they can have vaginal estrogens.
And many of us are on HRT. Can you take the two in tandem? This is a rhetorical question because I do. I have the estrogen ring, and actually, it's been an apt. This is oversharing, isn't it? I think I started taking it due to urinary issues, um,
Mhm.
and it's been absolutely brilliant. So now I've asked them to put it on repeat prescription. I do take HRT, but the HRT didn't seem to be getting to the parts it needed to.
Yeah. If you take systemic HRT, it obviously affects all your tissues, so it will help the urinary and bladder, the urinary and gynae symptoms. But about, I would say, a good 25% of women, the systemic HRT is not enough, and they need that local boost as well.
Yeah, it sounds like one of those that it should just be, you don't have to put up with this.
No.
There's very, very simple solutions. And
Yes.
are they all over the counter? Because I get my ring from the doctors.
No, there's some, the rings are still prescription only, but you can get the vaginal pessaries now over the counter. They're called Gina, Gina. So women can buy those for themselves or get it on prescription. So yes, it's worth going to see your GP or your practice nurse and get those on repeat prescription.
Absolutely. So I think I can remember seeing the announcement that this one was available. Just go into your local Boots or pharmacy and ask them about it. So that's great news. Joe, how are we doing for questions? I can see a lot coming up in the chat.
Wow is the thing I will say. People are really talking about this. Some amazing questions, but also lots of suggestions and sharing of things that people have found useful as well. So that's great to see. Thank you so much for that. Yeah, we've got a few. You've answered quite a lot of the questions already, which is fantastic. So thank you without even knowing it. But there were some kind of themes and topics actually. So people were asking about whether or not there are any natural alternative kind of creams or lubricants that might help for them if they can't, if they're slightly more sensitive to some of the, I think they talked about paraban related ones. So I don't know if there are any natural alternatives, Dr. Imogen.
Um, well, the vaginal lubricants, there's, I say, there's oil-based, there's water-based, there's silicone-based. So there's a variety. So one of those would suit them. Some
Right.
women choose to use like body oils and things down there. I think you have to be very careful with oil-based products because they can damage condoms and diaphragms.
Ah, okay, that's a really important point, isn't it?
Yeah. And just a quick plug, all women should use contraception for a whole year after their last period. And if they're under 50, they should use it for 2 years after their last period. And because I think that's not uncommon for women. Once they get into their mid-40s, they forget about having babies, and so therefore they forget about contraception. And obviously, it's much rarer to have a baby over 45, but it's not impossible.
Yes.
So
Yeah.
be careful with anything that's oil-based.
Yeah. Okay.
But there are some other sort of non-formula products out there that you can get in health food shops, absolutely. But I think there's a big selection of lubricants in Boots
Yeah.
to choose from.
So it's a try it out and see, and something will eventually suit you.
Works for
Absolutely.
you, yes.
Okay. That's really helpful. Thank you. And then, kind of on the same vein, actually, people are asking around, is there anything they can do with their nutrition or their food intake that might help as well, alongside all of those other things that you've talked about?
Um, Diet doesn't really make much difference to vaginal health. I mean, it makes a difference to our overall health, obviously, and eating healthily, Mediterranean style diet is good for our gut biome. And we also have a sort of what we call a vaginal microbiome, and that is healthy when it's got lots of lactobacilli, as I was talking about earlier, present. And estrogen replacement will increase that lactobacteria content and decrease the harmful bacteria. So that does increase our vaginal health. But there's not a particular superfood that's particularly good for vaginal health, no.
Right, that's useful to know. And then there was an awful lot of information there, really helpful information about over the counter and how to get prescriptions, etc. So people are thanking us for that already. So that's great information for them. In terms of then using kind of things post menopause, people are saying, will this typically get better post menopause, or could this continue post menopause as well? I think that's quite a common question from people.
Yes, and it's a common misconception, I think, isn't it? Because once we're through the menopausal transition, our menopausal symptoms are hot flushes, night sweats. Do for the majority of women, they abate. So most women, by the time they get to sort of late 50s, early 60s, their menopausal symptoms are going. However, vaginal dryness does not go. And I quite commonly see women who say, I went to the doctor and they gave me some treatment, great, but now it's all come back.
Yeah.
All the symptoms come back. So yes, it's got to be a continuous treatment for vaginal symptoms.
Okay, so that's useful to know. We can preempt that and be prepared, can't we, with the knowledge you're giving us, which is fantastic. And then in terms of people talking about their discomfort, so you gave some great advice about possible treatments and things. People are talking about examinations, so things like smear tests, or if they have to be examined when they're already suffering from some of these really difficult symptoms that they've talked about. Is there anything you can recommend about that that might help them, but won't impact the smear test results as well, I guess?
Well, what I get menopause, yes, smears are not comfortable after the menopause. And what I get menopausal women to do is to use some vaginal suppositories. Either I give them 2 weeks of suppositories to use before we do the smear. So that gets the vagina more stretchy, it increases the stretch and the lubrication, which makes smears much more comfortable.
Yeah, okay. That makes sense. And then I think we had another really interesting one. And Deborah, you talked about the ring that you use, and somebody's asking, did that help with the UTIs? Because I think that's often, as you've said, it's often another thing that can happen at the same time as vaginal dryness. It's interrelated. But does it help for those UTIs as well, using something like the ring? And is there a better one that they might be able to use?
I'm happy to share my experience because the reason I went to the doctors is because I sprung a leak. Never had that problem before, and I was kind of I was a little bit embarrassed talking about it because you know there's nothing. It did get in the way. It actually affected my confidence, and I stopped wearing trousers for a bit. Because I thought, oh, actually, it's this is a bit awkward. So I went and talked to the doctor about it, and I tried the ring. And just as you said, Imogen, it did get rid of the infection because I seem to have a bit of a recurring UTI situation going on, sprung a leak. And the doctor was very helpful in terms of giving me the ring and then suggesting what do you call them? Squeezes. What do you call those things?
Legal type of exercises.
Yeah, kegels,
Yeah.
kegels. I said, well, I actually do that, and I do a lot of Pilates, so I can't see that's going to be the solution. But the ring has been brilliant. But I thought that solved it, and then I stopped taking it, and then I had to go back to the doctor and said it was absolutely fine while I was taking this, but it kind of saw a drop off of the benefits, and I was back where I was before. So I did say, actually, no, I want to be on a recurring, I want this on a monthly repeat prescription, which they've given me. At the time, they were a little bit reluctant. Well, you've had it for a couple of months, but it does come back.
Yes. Yeah.
So now I'm probably more in the prevention rather than cure. And yeah, much happier about that. I've not had a UTI since.
And they can
No,
have
it
such a
was
big
very,
impact
very
on your
well that
life,
you're
can't they?
yeah.
Yeah, and it does whittle away at your confidence because you sort of always looking where the toilet is, feeling like you're nipping out of meetings all the time and thinking, goodness knows what people are thinking. I probably think I go to the toilet every 10 times an hour or something like that. But no, that actually sorted it. And it's interesting, Imogen, because of course I'm 60 now, and I didn't get that until post menopause. Didn't really have a huge problem with UTIs before, and it sort of snuck up on me gently until it was like, whoa, what's going on now? Which was this, I think I've sprung a leak moment. But I do think this is something that everybody should know about
Yes.
and
Yeah.
not feel that it's only you. I don't know how many women do actually struggle with this. Did you say 1 in 3, 2 in 3?
Well, it's supposed to be sort of 50% of women after the menopause, but I think it's underreported, so I'm sure it's more than that.
Right. Okay. And as you said earlier, there are so many things that you can do. not suffer in silence on this one.
Definitely,
And
definitely.
take some cues from Joe. How many times a day do we need to be saying vaginal dryness
A
before?
minimum of 5, I think, Deborah, don't you? It's a minimum of 5, and encourage others around you. And it suddenly just feels like a normal thing to say, doesn't it?
Yeah, well, it does now, but we've still got some way to go. But
Mm.
for me, Imogen, the big thing that you said was this isn't just those of us experiencing the menopause, because there might be other people that because we all see the tenor on ads, don't we? And things, and it could be that if somebody is struggling with urinary issues, it could be due to the fact they're breastfeeding.
Yeah, yeah, yeah.
So I guess what's our ask of people if you are struggling, go to your pharmacy, go and stock up on your. I think people have been sharing actually in chat some of the brand names with each other. So help yourself and go and have a little look. I saw something about Victory. Yes, Dr. Wool's Vagisan. I'm sure Boots will do an own brand as well. And go and talk to your doctor about your symptoms and whether you're already on HRT, the systemic HRT, or not. Vaginal pessaries, rings, creams could be appropriate for you.
And also, I often suggest to women who are wanting to come off HRT, the sort of older women, perhaps in their early 60s, who have decided they want to come off systemic HRT, that's the time to then start some vaginal estrogens, which will be safe for them for the longer term. And that because if they don't start, then they might well notice when they come off their systemic HRT that the vaginal dryness will set in at that stage.
Wonderful. Any other questions, Joe?
I think the only other one that came up a few times, and we've kind of answered it a little bit, but I think it's an important one, is can local estrogen creams or pessaries or the ring and the other things you've talked about, can they interfere with condoms or any other contraceptives at all?
Yeah, well, as I said, it's really the oil-based
Yeah.
lubricants that can interfere with condoms. Otherwise, no, should all be fine.
And they normally say on the pack anyway, don't they? They normally have that level of information, but that's great. So many people are saying it's a real light bulb moment. A, to be able to talk about this so openly, but B, the piece around HRT and localized HRT and the fact that at times you can take those together and it's not a risk. And that's a real light bulb moment for people. So that's great that you've been able to share that information.
Wonderful. And thank you very much, everyone, for sharing your questions. I forgot where I was for a moment, just got involved in a conversation. I think the one question that I've seen that was further up, it was, is there any better time of day to actually take the pessary or the cream?
Well, I usually say use it at night, just purely practically. If you insert the pessary or the cream at night when you're in bed lying down, it's less likely to leak out. So it can be a bit messy, but put it in when you're lying down, and then you've got all night to absorb in.
Little tiny question, bonus question here. If you're having sex that night, does it matter?
Uh, if you're going to use the estrogen, I would use it after sex
After
because A, it'll be a bit messy if you don't, and B, you don't want your husband to pick up a lot of estrogen.
yes, I was actually asking that one for my husband. He spotted that. But thank you very much, everybody, for joining us today. And thank you, Dr. Imogen Shaw and Joe Lee. We look forward to seeing you again. Take care.
Bye.